You're okay, baby.
Ellie Carney's loving bond with her Labrador Retriever Olive has made the pandemic more bearable. Ellie is 27 and has a disability.
Ever since COVID, Olive has been spending time with me. I'm not depressed anymore.
With professional help, Ellie has been living a mostly independent life for 3 years now. She's adjusted to the new normal, but her immune system is suppressed, so she's had to give up activities that might risk infection, says her mother.
When you have a disability, you really have to continue doing your independent living skills on a daily basis. And when COVID happened, Ellie did regress.
I miss my friends, I miss being active, and I miss bowling.
In this pandemic, people like Ellie face special risks. Their pre-existing health conditions make them vulnerable. They rely on others, and they are often forgotten.
And we all have needs. They're all things in life that are necessary for us, right? Food, shelter, clothing, in order to live a good quality of life. But people with disabilities have an extra set of needs. Each type of disability faces different types of barriers and supports.
At the Mary Marshall Assisted Living Residence, 70-year-old Muriel Chrysler gets government-funded care 24/7. Restrictions are gradually being loosened after a year of measures to prevent COVID outbreaks.
They've opened up the dining room once a week. They have opened up the community room, and people go in there and talk and, do activities again.
While keeping the residents mostly isolated helped control infections, it took a psychological toll, says residence head Davina Alston.
70% of our residents are diagnosed with schizophrenia. Even though you can take medications, we saw an increase in residents having hallucinations and being depressed.
Advocates are documenting the problems both in the U.S. and around the world.
Persons with disabilities should be prioritized in accessing vaccination. So this unfortunately has not happened in most places of the world. Dependence on family members can cause and aggravate experiencing violence.
In the United States, some 61 million adults live with a disability. Many are in group living settings, and that has penalized them.
33% of the deaths have occurred in the congregate settings. It was completely predictable that these would be death traps for the seniors and people with disabilities. There was poor oversight. They knew that there was understaffing and inadequate training for the staff that was there.
The Biden administration has created a COVID-19 health equity task force to examine disparities in care.
The fact that we have physicians and nurses and psychologists and social workers who go through their credentialing process and don't really learn much about disability culture, disability etiquette, civil rights laws, accessibility is a problem because it affects the quality of the health care that people receive.
There's also a presidential proposal to spend $400 billion for more home or community-based care for people with disabilities. If Congress passes it, the support workers who help Ellie and her mom will get a raise.
The DSPs get paid anywhere from $13 to $14 an hour. We really have to increase that number so that they can work 40-hour weeks and live off their salaries.
Money is important, but Mrs. Chrysler believes more can be done to change the way people with disabilities are perceived and how they can succeed with just a little bit of help.
I'm as normal as any other person walking on the street. I have a mental illness. I take medication for it. It's treated. If I had two legs, I'd be living on out there in the world.
Verónica Valderas Iglesias for VOA News, Washington.